The Effects of the COVID-19 Pandemic by Sochi Garcia. So what is COVID? Coronavirus are enveloped positive single-stranded large RNA viruses that infect humans and a wide range of animals. COVID-19 is an airborne transmitted virus that has spread to about 208 countries, 218 countries, and as of December 3rd, 2020, there has been a total of 65 million cases and 1,500 deaths. So some of the more common symptoms are fever and chills, cough, nasal congestion, fatigue, muscles or body aches, nausea or vomiting, diarrhea, and sometimes new loss of taste or smell. The more severe symptoms that are in need of emergency are trouble breathing, inability to wake or stay awake, new confusion, persistent pain or pressure in the chest. These are some COVID facts. Some COVID facts are that coronaviruses were first discovered in 1966 by Tyrell and Biney. Cultivated the viruses from patients with common colds, mainly found in mammals, especially bats. The virus succeeded in making its transition from animals to humans in the Huanan seafood market in Wuhan, China. A more common fact is older people and people with pre-existing medical conditions appear to be more vulnerable to becoming severely ill. The stay-at-home order. The nationwide lockdown was placed to help flatten the curve of COVID-19. However, lockdown has fundamentally changed work and transport-related physical activities. Physical distancing and isolation had detrimental consequences on the mental health of the general population. How exactly has it affected physical and mental health? It's affected mental health. During lockdown, studies have shown increased levels of self-blame, frustration, loneliness, helplessness, depression, and fear among the general population. And studies done in China showed that 35% of the population experienced psychological distress, and most likely to develop PTSD were women and individuals between the ages of 18 and 30 or older than 60. How it affected physical health. Due to the closure of gyms, sports and fitness clubs, as well as outdoor exercise facilities and leisure time activities. In the US, only 19% women, 26% men, and 20% adolescents met physical activity guidelines. So that means that before COVID, these were the percentages of everyone that would work out daily and take care of their physical health. In a sample of 3,000 US adults, people who were meeting those physical guidelines before the pandemic reported an average 32% reduction once social distancing went into effect. The demographic I chose to focus on were college students. I wanted to see how college students were affected by it because I am a college student. So these were some important stats I found. 91% have concerns of one's own health and the health of loved ones. 89% had difficulty with concentration. Online classes were subject to distraction due to the lack of interactions and prolonged attention to a computer screen. 89% disruption to sleep patterns, 70% disruption to eating patterns, either emotional eating or some of them even adapted healthier eating habits. 59% financial difficulties, 54% increased class workload, that they were concerned of increased class workload. 88% experience suicidal thoughts, 13% students have delayed graduation, and 50% of those students are low-income students. According to the American Council on Education, enrollment dropped by 15% in the fall of 2020. These are some coping strategies that psychologists were very important. Positive or proactive external expressions, which include reaching out to provide help, comfort, and support to family, friends, and neighbors, spending time outdoors, learning a new language, reading a book, playing games, or cooking. The other one is positive or proactive internal expressions, recognizing their true values and what changes they could make to live more in life with them, practicing mindfulness and meditation techniques, and trying to be more present in everyday life, becoming more appreciative of the things they take for granted. This is a link to a 1 minute simple breathing meditation exercise. So, what new trends have developed during the pandemic? Yoga and HIIT exercises were very popular, HIIT being high intensity interval training. Lots of people have tried to adapt simplicity, minimalism, and the use of signature ingredients. Adoptions of virtual health emphasizing immunity, brain health, and energy boosting attributes. Optimizing their circadian rhythm, which is the internal process that occurs naturally to regulate our sleep wake cycle. These are really important stats that I have found in my research. Rate of suicidal thoughts have increased and was highest among unpaid caregivers, essential workers, Hispanics or Blacks respondents, and young adults. 40 states have reported increases in opioid-related deaths since overdoses, both fatal and non-fatal, have increased by 20%. 40.9% of a study of 5,470 U.S. adults reported at least one adverse mental or behavioral health condition, including symptoms of anxiety and depression. In some regions, domestic violence hotlines experienced a drop in calls by more than 50%, which is really shocking to me because I thought that domestic violence calls would have increased. These are my personal tips and suggestions and things that I have been doing to cope with the pandemic. So, baking and cooking, I love trying new recipes and sharing them with my mom and dad, trying new crafts, keeping in contact with my non immediate family through Zoom and FaceTime. I try practicing self care at least once a day. I journal and document my feelings to reflect and just check in with myself at the end of the day. Going on family walks and having more family dinners, doing exercise challenges such as Chloe Ting Challenge and Jump Rope Challenge. This is a recipe for my favorite banana bread. And in conclusion, after my research, I feel like this pandemic has caused people a lot of internal and external problems, such as depression, anxiety, and PTSD, with more than 1 million deaths and probably many more in counting. With cardiovascular disease and suicidal rates increasing, this pandemic has definitely changed people's lives forever. I also feel like this pandemic has caused a lot of people to self reflect and enjoy the little things in life and overall practice mindfulness for their overall well being. And this is my reference page. And thank you very much.